Hello, my name is Dr. Matt Kearney. I'm Programme Director at UCL Partners and a GP. To support the new National Blood Pressure Optimisation Programme in UCL Partners, we've developed a new size of the prize for CVD prevention. All 15 AHSNs across England have launched the National Blood Pressure Optimisation Programme, and in their local areas the AHSNs will be working with primary care networks, with integrated care systems, to help them identify and prioritise patients with hypertension who are at greatest risk. Those patients with blood pressure that's less well controlled, and we know high blood pressure is one of the major causes of cardiovascular disease, of premature heart attack and stroke. So the primary care networks will be able to use the UCL Partners proactive care frameworks that include two core elements. So one is comprehensive search tools, stratification tools that we've built for EMIS and System 1. So that helps us in general practice to stratify our patients with hypertension and to prioritise, identify those patients whose blood pressure is least well controlled, so that we start with those patients, and also those patients whose blood pressure is very well controlled, whose care we can safely phase for several months' time. And the second element of the frameworks that are proving very useful are the resources to support the wider workforce. So using staff such as healthcare assistants, wellbeing coaches, the other additional roles that are coming into primary care, using those staff to deliver systematic structured support for patients with hypertension and other conditions, but support with education, self-management, behaviour change, helping them to understand what is blood pressure, what can I do about it myself, how do I measure my blood pressure, etc. So UCL Partners has also developed a new resource called Size of the Prize. This is a one side of A4 guide for integrated care systems, and it shows at a glance what the size of the prize is for CVD prevention by optimising the management of high blood pressure. So it shows the dip in QOF performance, the reduction in the numbers of patients who've got their blood pressure optimised to target. That dip, that reduction that's happened since the beginning of the pandemic. It shows that fall, and it shows that if we recover back to the pre-pandemic position, just how many heart attacks and strokes we will prevent in that population. But it goes further than that. It builds on the QOF recovery. It assumes that we must get back to that QOF recovery position. But then it shows us ambitions at different levels, achieving 74% optimisation, 77% and 80%. And for each level of ambition, for each ICS, it shows us just how many heart attacks will be prevented, how many strokes will be prevented, and how much money will be saved. And it shows that the numbers are substantial, that there is huge potential through this blood pressure optimisation programme to deliver population health improvements at scale. So in the blood pressure optimisation programme, the academic health science networks across the country will work with and support local clinical leaders, local clinical networks to help build and roll out this blood pressure optimisation programme. It is a programme with huge ambition, and I think that makes it exciting.